Often breast cancer presents with a nipple inversion. That means that the nipple actually goes inwards rather than outwards.
Today we are glad that Dr. Wong Chiung Ing with us. Hello, Dr. Wong.
Hello, thank you for the invitation. I'm glad to be here today.
Dr. Wong, can you explain to us what is breast cancer?
Okay, so breast cancer is actually a change in the cells in the breast, and what happens is that there is a loss of normal control for the division and the growth of cells. So in a healthy body, what happens is that there is a mechanism which controls the growth and death of normal cells. And when the normal cells become abnormal, they will die off, and there is a mechanism to control this. But unfortunately in cancer, this mechanism does not work very well. So these abnormal cells cannot die off, and not only that, it will grow uncontrollably, and when it grows and grows, it will become a tumor. And that's how breast cancer occurs.
We know that early detection is very important. So Dr. Wong, how often should we do a breast self-examination?
Yeah, okay, so breast cancer usually presents with a breast lump. So if you can do a proper self-breast examination, it will be very easy to detect a breast lump at an early stage. So it is recommended that we do a self-breast examination from age 25, and we usually recommend it to be done about 5 days after the period starts. It is because during this time, the breast will be less tender and less swollen. If you are menopause, we recommend it to be done every month on the same day of the month. After the age of 40, we usually recommend for women to also go for a clinical breast examination, which means they go to a doctor for a proper breast examination every year.
Dr. Wong, can you share with us what is the steps for the breast self-examination?
Okay, so it's actually quite simple, alright? There are 3 steps to it: look, feel, and touch. Okay, first of all, you look. What you do is that you look, stand in front of a mirror, you keep your shoulders straight, hands on your hips, stretch out a little bit, okay, and you look at your breasts first, okay. You see the 2 breasts, make sure that there is no change in shape of the breast, there's no obvious swelling, alright. Then you look at the nipple, and you just make sure that there's no change in the nipple. And often breast cancer presents with a nipple inversion. That means that the nipple actually goes inwards rather than outwards, okay. And then later on, you look at the skin around your breast, okay, and you have to look for a rash, redness. You look for any ulcers on the skin. You look for any scaling. You look for any dimpling or puckering. That means that you know that there is some hardness and redness on the skin of the breast, like an outer surface of an orange.
Yep.
Yes, correct. So those are also signs of what we call inflammatory breast cancer. It's a type of breast cancer which is actually quite aggressive. After that, you squeeze your nipple, alright, and make sure there's no abnormal discharge. For example, any milky, watery, bloody, colored discharge. So that is the looking part, okay. You do that with your hands on your hips, and then you do that with your arms raised to your neck. Stretch out a little bit to make sure that you look at the same thing that we had described earlier. After this, you will lie down, okay, and then you will put your left hand on behind your head, okay. Then you use your right hand to examine your left breast, okay. What you need to do is you use the fat patch of your 3 middle fingers of your right hand, okay, to feel your left breast, okay. So this is the structure of the breast, okay, and what you do is that you actually apply pressure, okay. Use your 3 fingers here, and then you use a circular motion. Do like a circular motion, okay, up and down. Don't move your fingers away from your breast, so you, as if you're mowing a lawn like that. So you top to the bottom like this, okay, like this. Go down like this, and go up like that, okay. Make sure you cover the entire breast, so up and down, up and down, up and down. Okay, another way of doing this is again with circular motion. You can go from the outer surface like this, outer surface first, go around this way, and then you can go like a circular motion into the nipple, alright. So after this is done, we also have to examine our armpits, okay, to look for any swelling or any nodules, and also underneath your neck here, alright, because these are where the lymph nodes are, and those can actually be involved by breast cancer, and it can present with a nodule at that area.